Hello, welcome back to HBB Strictly Education. So today we're going to be talking about what is gluten and why is it such a problem. Let's get started. Gluten is a protein found in certain grains, primarily wheat, barley, rye, and oats. So the first association with gluten was celiac disease in 1960 to 1970. And this is when the researchers began to better understand celiac disease and its link to the small intestine's inability to tolerate this gluten. In the 1980s and 1990s, diagnostic methods for celiac disease improved, and the availability of gluten-free products started to increase, but slowly. However, public awareness of gluten-related issues remained relatively low. So people had health issues, but they did not have information about gluten. Therefore, a lot of people were misdiagnosed. The concept of non-celiac gluten sensitivity began to emerge in early 2000s. So during this time, the gluten-free diet started to gain a lot of popularity, like not only amongst people who had celiac disease, but people that wanted to take care of their health better, or people that wanted to lose weight, or just gain the benefits of being gluten-free. Gluten-free diets and products became mainstream in late 2000 and 2010, with increased media coverage, celebrity endorsements, and a rapid growth of gluten-free options in supermarkets and restaurants. So the attention of gluten was driven by a combination of medical professions knowing more about gluten, which increased the awareness of it, right? And then which it brought about the consumer demand because now everyone knows about it. And then the commercial interest in the food industry, okay, where we can have now gluten-free on menus in the restaurants. Gluten can manifest in the bodies in different ways, depending on whether an individual has celiac disease or non-celiac gluten sensitivity. So understand that the manifestation of gluten-related disorders can vary from person to person. And some individuals, they may experience only mild or uncommon symptoms like a skin rash or eczema, headaches, or anxiety. But others may experience a more serious issue like diarrhea, abdominal pain, nausea, things like that. If you suspect that you have gluten-related issues, you do need to consult your physician. Do you have sensitivity to gluten? Eliminate gluten from your diet for a minimum of 14 days. Keep a diary of all foods eaten. Then do a gluten challenge. After following a strict gluten-free diet for a few weeks, you can intentionally consume a large amount of gluten, like a few slices of bread, and observe if you experience any adverse reaction within the next few days. Another quick way to see if you have a sensitivity is to do a pulse test. Take your resting pulse rate before consuming the suspected food. Then consume the food item. Check your pulse rate again at regular intervals of 15 to 30 minutes after consumption. If your pulse rate increases significantly, some sources say over 16 to 80 beats per minute, compared to the baseline, it is claimed to indicate a potential intolerance of the sensitivity to that food. So listed here are processed foods that contain hidden sources of gluten. Okay, so you always want to check your ingredients. But if you look here, this is a healthy villi. This is a healthy villi. But what happens when you have celiac disease or gluten intolerance, what it does is it damages that villi. Okay, and it takes about 90 days to repair this villi. So you want to make sure that you're going gluten-free if you have one of those issues. Now, it's best to cook at home versus eating out. Remember that rice and potatoes are gluten-free along with vegetables and your fruit and your choice cuts of meat, right? But now if you are a person that eat Italian sausage and that sausage is in a casing, you want to make sure that you read that it says gluten-free or no added fillers. That mean that you're safe. But if it doesn't say that, 9 times out of 10, it is a gluten filler in there. Now, if you have a gluten intolerance or celiac disease, you got to understand that when we eat gluten, we damage that villi, right, in our small intestines, and it causes problems with our absorption of minerals and vitamins and our digestive system. So eczema and skin rashes are common with a gluten intolerance. So on the next screen, I have a list of the ailments that can occur if you have a gluten intolerance and you have like hypertension or blood sugar issues like diabetes or anything like that. Because if you can't absorb chromium and vanadium, you will develop something like diabetes or anxiety or something like that. If you have let's say you are deficient in calcium because you cannot absorb calcium, then you may wind up with hypertension. So there is a lot of different ailments that can occur because you have a gluten intolerant. And most people don't know that they have a gluten intolerant. And one of the things that is a key issue is if you have eczema or some type of skin rash, psoriasis, if you have irritable bowel syndrome or something like that, these are signs that you may have a gluten intolerance. Okay, so one of the things that you want to do is on the next screen is you want to go through that screen to see if you have any of those ailments, and that will kind of help you determine if there is some type of gluten intolerance or celiac disease or something like that.